and I see some horrendous asymmetries. I'm sure you've seen it too, right?
I've seen it a lot.
Yeah. Why is that?
Well, my understanding is that it could be because of poor appliance design. It could be because of poor appliance placement. It could be because of not sort of rolling with pre-existing asymmetries in the patient's face.
Well, there are a lot of problems, right? I've seen some horrendous that it's not fixable.
I
Okay.
have as well.
Yeah. So, but
What's your understanding? You tell me, why do those asymmetries happen in MSC and MARPE patients?
well, there's so many variables, but one important variable is that you got to follow the patient.
Yeah.
Okay. I there's people will people would start turning for I don't know how many times before they come back for follow up.
Yeah.
Yes.
Yes, absolutely.
Okay. So if you don't believe it, I can show you my phone. I manage patients. Look, if they are my patients, if they're my patients, they have all of me, meaning that I want to make sure that it's done right.
They have your cell phone number, is that right?
They got my cell phone number, yes, and they send me photos three days, and sometimes a lot of times I say, you know what, 25% less, you're turning too much, this and that. Look, I know every patient, okay, so
Hmm.
because I at the end of the day, I want to make sure that the result is good. You tell me another surgeon who is going to get 3 photos 3 days a week from 30, 40 patients for months or throughout their when they practice.
Unheard of.
Okay, so now and if something's not right, I feel like, okay, you know what, I want to reposition it. I tell them, I want to reposition it. And why do people do it? You know why people do it? Because they are improving. I want to maximize their improvement. Okay,
Hmm.
so look, when look in my mind, when I take care of patients, we're on the same team. We're in the same boat. Okay, something doesn't go right, it we have to work together.
Yeah.
So now you know why, and I have certain standard. If I feel, look, by the way, that there have I had failures? Yes. The failure rate is not being able to get what I believe is sufficient expansion. Is that after the initial surgery exam is not, you can't expand, not successful, blah blah blah. Then what I tell them is, if I don't feel like it's something that, I if it's something that I could do better, I tell them, you know, we need to stop.
Mhm.
You need to heal. If you still want me to do it, you let it heal for 9 months or whatever. You come back, I'll do it again.
What does a failure mean to you? Do you have asymmetry sometimes? How do you prevent asymmetry? How do you deal with it when you
Well,
see it forming?
I tell every patient, well, none of us are perfectly symmetric. That's number one, right? Number two, every expansion pattern can have a little bit of asymmetry, okay? But you don't want the asymmetry to be noticeable, and you don't want the asymmetry to be affecting your orthodontic result. Okay, so I follow patients, so I could see what's happening, right? Every other day, I'm watching them, right? Sometimes I say, hey, you know what? You're turning too much because you're pushing the tooth. This is not what patients do. So I'm their coach, right? So
Yeah.
it's now you know why that the way that no one does it, because it's so labor intensive. It would have been much easier and much more economical. If all I do is MMA, it's easy. 3 4 hour surgery. They come in town. I operate. They stay for 10 days. Out they go. Done.
Mm-hmm. So are you're saying that asymmetry cannot necessarily be prevented, but it can be managed, and management means not letting it go too far. And management essentially means not letting it get out of hand to the point where you have an orthodontic disaster that takes years to correct with tooth tipping and invert
Absolutely.
and
And
intruding and
absolutely. Absolutely.
MMA being required to get the to fix the cant.
This is the problem. MMA cannot really correct significant facial cant because you're talking about the zygoma.
Right.
You're not just talking about this part, you're talking about the entire face. I've seen them.
I have too. So these severe MSC asymmetry cases where, and there's one very famous one that's been posted on Reddit, and I could screen share that.
I don't want
Maybe
to, you know what?
that's fine. But you can see her whole face is like this, and the whole left side is down. Her bite plane is off, and her mid face is off. You're saying surgically you can maybe fix the bite plane, but this part of her face is always going to be lopsided. Is that right?
Unless you do mid-facial reconstruction, zygomatic osteotomy, and you know,
Or maybe you could camouflage it with an implant on the other side, or
sure,
create. But now you're getting messy. Now you have a mess that you're dealing with,
right.
basically.
Now you have a
Yeah,
mess.
yeah.
Okay. Now let's talk about. We're on the right topic. The diastema formation. People are getting, I don't know, 7 8 millimeter expand, diastema. Why is it that there are plenty of patients that have no diastema.
How is that possible to
It,
have a
well,
maxillary expansion with no diastema anywhere
well,
anatomically?
because it's a midface expansion with palatal expansion. So if you look at my 3D CT, like I said, there are 100 cases at least. Look at the CT scan. The expansion is a pure midfacial expansion, so it's really a midface expansion. But the teeth, most of the people with a little bit narrow jaw, their teeth are flared out like this.
Right.
Okay, if you look at them, their teeth are sort of angled. Pre, post is more straight up and down. Just look at the CT scan. I'm not gonna look. It's out there, right? I'm
Yeah.
not faking it. Just look at the CT scan. Look at how this. So basically, and the teeth. That because I'm not dramatically changing the alveoli. But by the way, people say, "Oh no, you're not widening the palate." Oh yeah, I'm widening the palate significantly. Look at the pre and post.
So patients are getting more tongue space with ease?
Absolutely, they get better tongue space because if you're doing the alveolar expansion, you're doing kind of this. And
Yeah.
let's move on, okay? And this is a
Okay.
good topic. This is a good segment.